Hey, I'm Leslie Turner. I'm a mom, a somatic practitioner, and an intuitive coach. This is the Intuitive Drop, short conversations about emotional truth, the nervous system, and living from your intuition in real life without losing your mind along the way. Let's drop in. Hi, everybody. Welcome to another episode of the Intuitive Drop. Today's episode is personal. It's mine. I've been sitting on this for a while because I needed to know how it ended before I could tell it properly. Now, before we get into this, if you are someone in the middle of your own health story right now, I just want you to know that I haven't forgotten you're listening. This is my experience with my outcome, and I'm holding yours gently alongside as I tell this. Okay, from the top. Just after Christmas, this past year, I noticed something. Clear discharge from my nipple. Cue all the men exiting this podcast right now, and that's okay. And this is what I actually did about it, because it wasn't nothing and I wasn't in denial, so I assessed it. I have 11 years as a naturopathic doctor. I used to do breast exams on a regular basis. So I did one. There was clear discharge. It was not bloody or dark. Those would have changed things entirely. There was no palpable mass, no puckering or tension of the skin, symmetrical movement on arm raises and contraction of the pec muscles. I went through the whole checklist, the one I used to run on patients, and nothing was flagging as urgent. So I didn't ignore it. I evaluated it, and I made a clinical judgment that it could wait a few weeks and be watched. Now, the thing about being trained in something is that you can use that training to legitimately talk yourself into a reasonable sounding conclusion, and I did. I wasn't wrong exactly, but I also wasn't the right person to be assessing me. So, after a little while, I booked in with my nurse practitioner, and she took one look at what I was describing and immediately scheduled me for a mammogram, my first one. There was no deliberation, and that was the first moment my body went, oh, okay, we're doing this. So I had the mammogram, and they found something on imaging. So they immediately scheduled me for a biopsy. I think the biopsy was about 4 or 5 days after the mammogram. And what gets a little bit more interesting is, and by interesting, I mean like very human, a little bit ridiculous, between the mammogram and the biopsy, the discharge actually stopped. It just went away. And without that physical reminder, I kind of drifted. I didn't forget exactly, but I stopped holding it close. I let it move to the background of my brain. So the biopsy itself, not the most pleasant experience, but they numb you, so it's not terrible. They placed a small titanium clip or a marker for imaging purposes so that they'd know exactly where this thing was. And I remember thinking, that seems like a very permanent thing for something that was probably nothing. So the biopsy came back clear, and my nurse practitioner called with that result, and I exhaled and thought, okay, perfect, we're done. Except then she said, your biopsy is clear, but I still want to send you for a surgical consult. And I said, okay, because what else do you say to that? And then I went about my life. So then by the time I got to the surgical consult, the discharge was back. The surgeon assessed, and I almost didn't think it was real. I was like, oh, I didn't realize it had come back. And he looked at me, he goes, yeah, this needs to come out. And something shifted in that moment. Up until then, this had been a series of appointments, precautionary, probably nothing. And then it became, we are scheduling surgery. I drove home that day thinking, oh, this might be a bigger deal than I thought. And 3 weeks later, I had a lumpectomy. Now, my husband dropped me off at 8 a.m. with my son. He was driving him to school. And I walked into the day surgery area by myself with a big bag that I had packed as though I was going on a weekend retreat. It had books and snacks and layers. I was very prepared. And I used approximately none of it. I didn't even open it. So they gave me a blue gown, standard hospital gown, the one that fits everybody, plus a brown robe to go over top of it, and these blue booties that go on bare feet. And I was by myself for the first little while. They did have to put an IV line in me at the beginning for antibiotics, and that sucked. That was like the most painful part. And they assessed my blood pressure. My blood pressure was 150/88. And if you know, normal blood pressure is actually 120/80. And my blood pressure would not come down. And I want you to kind of notice that, because I, the woman who had clinically assessed herself and made a reasonable judgment and had largely stopped worrying, had a blood pressure of 150/88 sitting in pre-op. My mind had a narrative and my body had a different one. So I'm sitting in the waiting room surrounded by people who are all dressed the same as me. And my husband came in around 10:30 or 11 to keep me company. And he looks to me and he goes, "This is the world's worst toga party." And I laughed. I had to agree with him. That's his line. I'm keeping it. The waiting room had a woman, this is like annoyingly funny, had a woman on a speakerphone telling her husband exactly what variety of tomatoes he needed to pick up from the greenhouse in detail. And I think I whispered under my breath, "Ma'am, please, like this, we're all a little anxious here. Please don't ever, in a crowded area, speak on speakerphone. No one needs to hear your conversation." A man sitting next to me caught my eye and just nodded and was like, "Yep, I'm exhausted. I know that lady's something else." Anyway, Jarrett was with me maybe half an hour before they took me back to the pre-op area. And there were 3 of us sitting there. We weren't really making eye contact. We were all hooked up to these IVs. And I broke the silence and said, "Well, this is fun." And one woman laughed, and that felt like a huge win for me in that moment. They asked my name and date of birth approximately like 62 times, and then I went into the OR. Now, the OR was exactly what you'd expect if you watched any medical dramas from the 70s and 80s, except colder and somehow more sterile than you can imagine. There's no beauty in it at all. It's all function. And I remember they finally put a warm blanket on my legs, and I got thinking, oh, that is the kindest thing in this room. Then the anesthesiologist put a mask on me. The medicine started, and I remember saying out loud, I don't know why I said this out loud, "This feels like when you're on mushrooms." In reference, I've only done that once, but still. Anyway, that was the last thing I remember. The surgery was about 35 minutes. I had some really cool dreams on the table, which I maintain is a bonus. And then I woke up in recovery. It was a completely open area. There were curtains kind of around us separating people waking up around me in various states of groggy and pain. I remember asking for apple juice, and I tried to go back to sleep because the naps in the OR are genuinely excellent, but I wasn't really sleepy. My nurse's name at the time was Sam, and I remember at some point I started to cry. The kind of crying that doesn't really have a reason. It just comes and you can't control it. And I asked her, "Hey, Sam, is that okay if I cry?" And she goes, "Yes, of course." And of course it was. And I want to stay here for a second, because that moment, waking up and crying without knowing why, that's my nervous system doing something important. It had been holding something, and the anesthesia had lowered the wall just enough for it to come through. This wasn't fear exactly. It was just release. The body had been braced, and now it wasn't. And it didn't really know how to transition to that quietly. That night at home, after my husband had fussed over me and my son had been very concerned and sweet, I lay in bed and I did something that will make sense to some of you and will confuse others. I said out loud, if I picked up any energy during that surgery or during my hospital stay that isn't in my highest and best, please leave now. And I meant it. The opioid pain medication they'd given me had made me feel dizzy and nauseous and profoundly disconnected from my body and intuition. It felt like exactly the wrong state to be in. So I made a decision to stop taking the meds, switch to Advil. And some of you will understand why. That's enough. But I got a very clear image as I said that command of this man, this tall, skinny, stringy, long hair man, kind of waving goodbye. And then I felt cleaner after that. I woke up the next morning craving chocolate bars like crazy, and my husband went out and bought 3 of them. Anyway, recovery is strange because there's a point where you feel mostly okay, and you almost start acting like it's over. And then your body reminds you that it's not. So a few weeks out, I took off the steri strips, a few days out, I guess, I took off the steri strips. There was a little bit of tenderness because everything, as I would describe it, was kind of free balling. And anytime I went over a bump in the car or on the four-wheeler, yeah, that hurt. But the scar is minimal. The bruising is non-existent now. And despite the fact that my surgeon had the bedside manner of a turtle turd, he did a great job surgically. You don't always get both. Sometimes you just have to get one and thank your lucky stars. What I noticed in those in-between weeks from the surgery to now was my shoulders. Prior to the surgery, they were up around my ears. They were so tight. And then they got better after the surgery, and then they started to ramp up again. I was still bracing. And I knew what that was. My body was waiting. It hadn't gotten the all clear yet. And no amount of telling myself that the biopsy had come back clear, no amount of reasoning was going to change that my nervous system was still braced. It knew that we weren't out of the woods yet, technically. And I think that's worth saying because we talk a lot about trusting our body, and sometimes trusting your body means acknowledging that it's going to hold vigil whether you want it to or not. You don't get to just decide to relax. The nervous system has its own timeline. So I went in today to my follow-up appointment knowing I was probably fine. I had a feeling, and this is the intuitive piece, the part that's just me, that I teach to people, that if something had been wrong, they would have probably called me in sooner. 3 weeks had passed. No urgent call. My body had a sense of, we probably would have heard by now, and I can feel that this is okay. And I was right. It was called the benign ductal papilloma. Nothing further is needed as long as I stay symptom-free. The surgeon told me this in about 30 seconds, and I nodded and thanked him and left. And then in the parking lot, I started to cry. I wasn't scared, I was relieved, but relieved that my body could set this down. That the thing it had been holding, the quiet vigil, counting down that day to a clean bill of health, it's been about 5 months. And I finally got permission to stand down. The shoulders, the bracing, that low grade, we're not quite done yet. All of it just started to move. And that's what the nervous system does. It holds, it waits. It doesn't respond to logic or reassurance. It responds to resolution. I thought I wasn't worried. I genuinely believed that. I kept going with my life like it was no big deal. I had a narrative of, it's probably fine. And I was living inside of that. But my body never believed that narrative for a single day. 150/88 in the pre-op, shoulders tense around my ears for weeks, tears in the parking lot on a sunny Tuesday afternoon. The body kept its own narrative, and it doesn't care what story you're trying to tell your brain. One more thing, because someone said this to me after surgery, said, oh, the papilloma, that's an HPV thing, right? The human papilloma virus. It's not actually. I want to say that clearly because Google is a dangerous place when you're scared and misinformation doesn't help anyone. A ductal papilloma is a benign growth in the milk ducts of the breast. It's called a papilloma because of its shape. The word just means small projection. It is not caused by HPV. It is not related to HPV. HPV is a sexually transmitted virus associated with cervical, throat, and some other cancers. Ductal papillomas are caused from an overgrowth of the cells lining the milk ducts. There's hormonal factors that play a role, but the cause isn't fully understood. They just know it's not a sexually transmitted infection. So if you've been diagnosed with a ductal papilloma or you're waiting on results for one, it's not that. You can put that particular fear down. So that's the story. 5.5 months, I guess, from the first symptom to standing in a parking lot crying because my body finally believed it was okay. I don't have a huge takeaway wrapped in a bow for you, but what I have is this. Your body is always tracking something, even when your mind has a very reasonable, articulate narrative of why everything is fine. Even when the biopsy came back clear. Even when you really genuinely believe you're not scared. Pay attention. Pay attention to where you're bracing, where you're holding, what your shoulders are doing. There's not necessarily something wrong, but it's because that's where information lives in the body. And if you're in the middle of something like this right now, waiting on a result, holding your breath a little more than you're admitting, shoulders tight for reasons you keep explaining away, you don't have to hold that alone. I'm not going to pitch anything to you today. I just want you to know that if you need someone to sit with you, to remind you that your body is doing exactly what it's meant to, I'm here. I've just been there. And you can find me at leslieturner.ca or just DM me. Seriously. Thanks for being here.